this. So you know what the OECD does. It stands for the Organization for Economic Cooperation and Development. And large part of it is understanding what are the economics that impact our abilities to make collective progress to improve the lives of people. The mission of the OECD is to how can we have better policy for better lives? And that really is our overall mission. We all know that in the world of artificial intelligence and health, there are a significant number of areas where we can actually use AI to improve both health outcomes, better experience, and better efficiency within our health systems, be it through improved booking of appointments, but be it through improved surveillance and more or less review of their populations to improve the overall health of our people in order to look at some of the opportunities through predictive public health. What are some of the preventative measures that we can start to encourage people to do to prevent the onset of chronic diseases, or and especially to prevent the onset of multi-chronic and more complex illnesses and disease? We know that using AI, we're accelerating innovation with respect to drug discovery. Work that was done a couple of years ago in the UK demonstrated that by using the AI, we're able to accelerate discovery from literally 18 months to 18 weeks. This is our significant things that we can do to accelerate the system in order to achieve better health outcomes for all. But practically speaking, we are beset in health by having lots of forces against us to actually do the scale of health well. Are the incentives in our system incentivize individual institutions and don't incentivize cooperation across health systems? We are certainly, there is significant worry, fear in some cases around the use of AI. We don't understand it. We are concerned about it. We hear that it hallucinates. Will it cause me harm by using it? I am worried. Also, is it going to be something that's going to, change my job if I'm a health provider? And how do I actually adjust to that? We also have the challenges with the workforce that they have, when we've been doing a lot of the digital innovations the last 10 years, we have harmed the workforce by really inserting a computer screen between the doctor and the patient. What is it that we can do to help remove that screen and help doctors return to the thing they love doing, which is providing care, as opposed to administrating their system through digital tools and technologies? And the last one that I'll call out is our weak data foundations. And this is true across OECD countries. Some are more advanced than others, but in general, when we did the digitalization of health, what we did, we focused on buying the newest technologies without focusing on the real value that came out of digitalization, which is to say the ability to capture the data in an electronic way, to use that data to connect together a complete health patient profile for a person and use that patient profile for greater understanding of how we can actually improve care for the patient. These are all things that we can do if we address these barriers. But addressing these barriers is hard because within health, we are beset with three different forces happening at the same time. We have market forces that want to move fast. These are the hype engines, the technology headlines about how AI is revolutionizing the world, will change all of our lives forever. And there is a sense of urgency that if we don't act, we will be missing out. Having said that, from a health perspective, we also need to respect the Hippocratic Oath, wherein we must first do no harm. So how can we move fast and while respecting market forces while we're doing no harm? And importantly, the third force, arguably the most important force, is making sure that the value that we're getting out of AI is scalable to people, that we're grounding the investments in AI in human outcomes. And that's where collectively, one of the things we talk about the OECD is how to scale fast while doing no harm. So under that theme, we held a conference in Madrid 2 weeks ago. Oh, sorry, one other thing I wanted to call out. Um, we did a survey of all OECD countries to see how ready are they to be advancing this work around AI. And bluntly, the answer is not very. Lots of work and activity are being done, especially in and around pilots, but little is being done to set the strong foundations that are necessary for health and AI to be working together more effectively. 7 countries, the ones that are listed at the bottom, have created specific strategies or action plans at the intersection of those three forces of the market, health, and humans. And one of the things that they have realized in so doing is that by having that focal point of a strategy at the intersection, it creates a space where an accountability where the issues, the tensions that exist between the forces can get resolved. Without having that specific oversight, the leadership at that intersection point, what you end up having is technology people yelling at the health people saying, why can't you move faster? The health people saying, but we can't because we want to do no harm. And the public saying we feel like we're just a bystander to something that is deeply personal to them. We also recognize there are many other areas that are foundational for AI in health, where frankly, many OECD countries across those countries, less than a third of OECD countries have taken meaningful steps toward building the foundations that are necessary for AI in health. So there's a need for action, and there's a need for action together. Because one of the things about AI is we want to be able to scale AI not only within our countries, but also with other countries together, both to gain the benefits that others have learned from AI into our countries and export the value of AI from our countries to others. So with that inspiration, we created this conference that we held in Madrid 2 weeks ago, where really what we were trying to do was to find the signal for what countries should be doing above all the massive amount of noise that is being created to the advice that governments and policymakers are getting. Ultimately, the question, what is a clear signal that needs to be created? We're still in process of developing our action plan as a result of the conference, but I think it's important or at least an opportunity for me to share with you 5 of the core themes that came out of the discussions. These 5 themes were, first of all, health no longer starts with a patient meeting with their doctor or a health professional. Health now starts with a patient meeting with their cell phone, so to speak. We know that more than 200 million people are using ChatGPT this week for health-related queries. We know that 1 out of 3 patients in the United Kingdom will consult with AI for a diagnosis before they meet with their doctor. So neither of those numbers are likely to go down. But the challenge is, how do we know that the AI systems that the patients are using are actually giving them good advice? They're giving advice that are created by, for the most part, large technology companies. So how do we assure that the advice that the public are getting is of good quality, is actually aligned with health system goals, individual goals, health system goals, population health goals. The second thing is that for adoption happens at the speed of trust. If we can invest all we want in the tools and technologies, but if we haven't invested time effectively into the people who are directly or indirectly impacted by AI's use, then frankly, they are never going to adopt the tools and systems. So all the investments in technology will not matter. We need to be reshifting our focus to how do we improve the understanding of the use of AI, the awareness of AI, the opportunities from AI to get people to be excited about the opportunities while they are aware of its risks. That is a big part of really what trust is about. Trust built on hype doesn't work. It's a balanced approach to what AI can and can't do and how the health system is effectively responding to it. Having said that, the reason there is urgency is that we're now at a point where the use of AI, especially by health professionals, for the provision of care, is actually safer than not using AI. Now, that is not true in every case, in every individual scenario, but there are certainly scenarios where the use of AI with a health professional is safer than the health professional alone. So what is it that we need to do to accelerate the uses of AI, to validate the uses of AI, to actually approve the uses of AI? Where it is actually most beneficial to the system, beneficial for outcomes, beneficial for the provider, while again minimizing harms. Fourth thing that we called out is that scale is really the definition of success. A joke that was made in Madrid, I don't know how well this is going to translate, but the health system has more pilots than airlines, which is really a reflection of we are really fascinated and we incentivize individuals going out and doing their own thing. But the challenge by doing that is we have a lot of fragmented solutions that don't fit together well, and our health systems themselves are not designed to take the successful pilots and be able to scale them across populations. We need to re-incentivize the system in order to really understand how do we create the economic outcomes and impacts that we want by providing the right incentives in the right place in order to achieve the benefits of AI for all. And the last one that I will call out is that all of this is true, but key ingredient for AI is the data that we have and the digital tools and technologies that we have invested in over many years. The way that I think of it is that the digital tools are pipes, the data flowing through the pipes are the water, and AI are taps, extracting the information out so people can actually use the insights, use the water in the practices of what they do. We need to be building and strengthening our data and digital infrastructures in order to be able to use the insights from AI most effectively going forward. That is really my charge to you today, is to really think about across all of these dimensions, what is it that you can do to help strengthen your data and digital foundations? How can you develop incentives to scale solutions to really embrace cooperation across partners because nobody can do this by themselves? And how do we ground this work in trust? Because without trust, again, we won't be able to scale, and really putting this patient at the center of all the activities we do, because our incentive to act is because we know that by implementing AI in our health systems, we are going to create better health outcomes for all, better experience for our providers, and better economic outcomes for the entire system. And with that, I thank you very much. And I wish you a good remainder of your day. I think it's going to be extremely exciting all of you folks, you're on the forefront of change, and this change is massively both challenging and exciting. And frankly, if it wasn't challenging, it wouldn't be exciting. And so I really think it's going to be great to really hear the energy from the room in and of itself. Thank you very much.
Thank you, Mr. Sutherland.
Por habernos acompañado el día de hoy en el Foro Nacional de Inteligencia Artificial en Salud, segunda edición. Este foro fue presentado por ULACIT, Cámara Costarricense de la Salud y DHIT. Nos veremos en la próxima edición. Síganos en redes como ULACIT. Buenas tardes.